Hi Moving Mamas, and welcome to this deep core strengthening session. Diastasis Recti, this is something that I talk about a lot. That is the separation of the abdominal muscles here at the front, because when we're pregnant, all of these tissues become overstretched, and the connective tissue between the six-pack muscles in the middle is called linea alba. And this, along with the rectus abdominis muscle bellies here, the six-pack, become overly stretched during pregnancy, and often the connective tissue isn't as strong again after pregnancy, especially if you've had gone through more than one or two pregnancies. So strengthening our deep core muscles, you know, the muscles at the front, at the side, pelvic floor, diaphragm, this is the core. Strengthening the deep core muscles is really important after pregnancy. So today we're going to be strengthening our deep core muscles. We're going to start with the basic breathing technique that we use in all deep core exercises. This is the foundation of deep core workouts or deep core exercise, deep core work. That is diaphragmatic breathing, sometimes called 360 breathing or belly breathing, but it's basically we are engaging our diaphragm, the big dome-shaped muscle that divides our abdominal cavity and thoracic cavity. This muscle moves up and down during breathing, and we are going to be actively engaging this muscle while engaging our deep core muscles during breathing. So first we're going to just do 10 breathing cycles of diaphragmatic breathing. And when we do that, when we inhale, we want to relax everything, relax all muscles. So it's maybe best to do this from the side. You can do this standing or sitting or lying, just what suits you best. I'm going to be turning this way so that you can see my abdomen now. So when we breathe in, when we inhale, we relax everything here. And then when we exhale, we start by engaging the pelvic floor, kind of like we're trying to hold in P, just a little. We're not going to be squeezing here, just a little bit. And then we engage the core muscles here on the side and on the front, and kind of think of squeezing the air out of our lungs. Another good tip when we're practicing diaphragmatic breathing is to think about when you're blowing into a balloon. So when you're blowing into a balloon, everything that we just said right here is going to happen. We're going to engage the whole core to be able to expand the balloon. So we'll begin with an inhale. We'll do 10 breathing cycles. Inhale, relax everything, and then exhale, engage the pelvic floor, engage the whole core, and press the air out of our lungs. You can see that my pelvis tilts a little bit when we exhale. Five. 2 more. Good. Now, we're going to be doing kind of the same thing, but we're going to do pelvic tilts, and we will do diaphragmatic breathing while we do that. So when we lie down like this, there's a gap here between my lower back and the floor. But we're going to be closing up this gap here. So tilting our pelvis backwards while we do diaphragmatic breathing. And we'll do 10 breathing cycles here as well. So relax when you inhale, and then engage your pelvic floor, engage your whole core, Press the air out of your lungs and tilt the pelvis backwards, closing up the gap between your lower back and the floor. Five, 6, 7. Really engage the core and close up the gap. And one more. Good. Now be careful when you go up. You can go up like I did right now if your core isn't quite strong. My core isn't as strong as it was before. I've had 4 kids now. My youngest is soon 10 months old. So I still don't have all the strength in my core like I used to. Now we're going to come up on all fours and do bird dog. And we'll do the same. We will do 1 breathing cycle here per rep. So it's going to take a little time. We're going to do 5 reps on each side. So relax everything here. You see that my belly drops down to the floor. And then exhale, engage, and reach out. And we're going to alternate between sides here. And re-engage for each repetition. We're working our balance here. That's why we exhale and engage before we reach with our hand, arm and leg out. One more time. Good. So one thing that's really important to keep in mind when we are working with our deep core is that this is not going to be perfect for the first time or the second time or the 10th time. I'm still working on my deep breathing technique and it's always getting better and better, always improving. But do not let that stop you to perform these exercises if you feel like you're not getting the hang of the breathing technique. Just do it at your own pace and really keep in mind what you are doing here, trying to reconnect the mind to muscle connection. That's the most important thing here. Now we're going to do 2 rounds consisting of 4 exercises. So we're going to do 4 deep core strengthening exercises in a row, and then we'll take a little pause, and then we'll do this again. And then we're finished. So first is a supine leg reach. So we're going to be, supine means just that we're going to be lying on our back. And then we will engage our core, closing up the gap here. And then we lift our legs up like this. And now we're going to keep this core tension, this core engagement throughout the whole set, throughout this whole exercise. We're not going to re-engage for each repetition. And now we're going to reach with one leg like this. 10 times each side. And check in with yourself throughout the exercise. See how your core is. Is the lower back where it's supposed to be? Are you experiencing coning? If so, just re-engage and start again where you left off. And I do small inhales and exhales throughout the exercise. One more time. Good. And now we will move on to knee hovers. So we're going to stand on all fours and lift our knees up. If this is bad for your wrists, you can stand on your knuckles as well. So just find a comfortable position. Inhale, relax, and then exhale, engage, and hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. And again. One, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. We're going to keep using the knee hover position. Now we're going to reach with one leg out like this at a time while we hold ourselves up. So 5 reaches on each side. Engage, hold the engagement here, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good, and down. And now straight to a side plank. So we'll do a side plank first here on the left side and then on the other side. If you're not able to do a full plank, you can do it on your knees. The leg that's under, you stand on the knee here and lift. You can have your arm up like this, or like this, or like this. But otherwise, you can stand on your legs and then engage the core and lift up and hold. We're going to hold for 5 seconds and then we're going to do small rotations. So reach, 1, 2, we'll do 5 of these, 3, 4, 5, good, and down, switch sides, and engage, lift, up, 1, 2, 3, 4, 5, and rotate, 1, 2, 3, 4, and 5. Good. Now, rest, get some water. And one thing that's important to mention, you probably heard of doming or coning here in the abdomen. It's not dangerous if you experience this. It's not something that should hold you back. If you experience it, just if you see that you have doming or coning or you feel it, then just try to re-engage the core. You know, do the diaphragmatic breathing again and really hold the core tight. Doming or coning may be a sign of that your deep core muscles aren't engaged enough. So that's why it's good to try to re-engage the core. But if you still have doming or coning, it's not dangerous, it's not harmful. So you can just continue and keep the core as tight as you can. Okay. Okay, and now we'll do these 4 exercises again. We're starting with the supine leg raise. Supine meaning lying on our back. Okay, engage the core. lift. Good, everything's engaged, and 10 reps for each leg. Small inhales and exhales here. Exhale when we are here. We keep the tension in our core, but we do small inhales and exhales, and exhale when we need to engage more in this position. This. Now I forgot my counting. That's fine. We'll continue a little bit more. 1, 2, 3, 4, 5, 6. Good. Probably did more than we were supposed to. That's fine. Knee hovers. Again, if it hurts your wrists to stand like this, stand on your knuckles. Engage the core and hold for 10 seconds. 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Down. And engage again. Up and hold for 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good. We're keeping the knee hover position. And engage again. And now reach with one leg at a time. Small exhales here. Hold the core engagement. 4, 4. One more time. And 5. Good. And then straight onto the side plank. Engage the core. Lift and hold for 1, 2, 3, 4, 5, and then rotate. 1, 2, 3, 4, and 5. Good. Switch sides. And engage. And lift, hold. 1, 2, 3, 4, 5, and rotate. 1, 2, 3, hold the balance. 4 and 5. Good. Awesome. Now, if you do a routine like this every day or almost every day, this is going to have a huge impact on your deep core strength, the looks of your core, of your abdomen, your posture, back pain if you're experiencing. This is going to help also with leakage if you're experiencing surprise leaks, for example, when you're jumping on the trampoline with your kids or sneezing or coughing. Because what we're doing here, we are also training our pelvic floor. We're not doing what we're taught when we're doing Kegels, to just squeeze all that we can with our pelvic floor. No, here we are doing a gentle lift of the pelvic floor at the beginning of each breathing cycle. So when we engage the core, like I said in the beginning, we do a small lift, a small squeeze, just kind of like we're holding in P in the beginning, and then strengthen the core. Okay? So I hope you enjoyed this session, and I encourage you to do a routine like this also as a warm-up routine before an exercise. Now I feel ready to do something more, so if you want to do that, you can join me in our next workout. So if you like this session, please hit the like button and the subscribe button. I would be really, really appreciative if you would do that.